sternocleidomastoid. Mastoid is, this is the mastoid. From here it ascends upward direction, and this is the mastoid process, and this is the insertion. This is the origin and this is the insertion of the SCM muscles called as a Wangku. Wangku. To means is the head, Wangku means is the gallbladder 12 acupuncture point. There is the communication. Now this particular point, stomach 9 point, is located on the anterior, means is the front border of the SCM muscles. Now we try to understand another location. What I told you, 1.5 chone, lateral means away from the body. So now Adam's apple, try to find out, try to touch and feel. This is the Adam's cartilage, right? From here 1.5 chone lateral. Now 1.5 chone lateral, you have to cross like this. Now this is the entire area muscles to be known as a SCM muscles. This is the SCM muscles. This called as a clavicle head and this called as a sternal head. There are the two heads for the SCM muscles. Now these two muscles, it comes downwards direction. That means this, from here you try to find out, this is the muscles anterior portion to be known as a Ren Ing. So this is in fact is the very superficially we just apply. So stomach 9 Ren Ing point. So what are the beauty of this particular point? What are the vulnerable, why is it says is the vulnerable point? Because that particular area to be known as a carotid artery, the common CCA, common carotid artery, ascends the upward direction through the aorta, which communicating to the central nervous system brain. So therefore once we need to palpate and then apply lateral to this particular point, that is common carotid artery is ascending upward direction, lateral to that position to be known as a jugular vein, the internal jugular vein and external jugular vein. But internal jugular veins are communicating from this particular region, and also it will support to the vagus nerve as well. If we puncture this knowingly, unknowingly, that you are going to rupture to the internal jugular vein, you are going to damage to the internal carotid artery. If you apply on the deeper level, that will collapse to your thyroid gland as well. By the way, this particular point to be treatable for the thyroid, parathyroid and thymus gland as well. But however, this support to all the three glands, but majorly for the thyroid gland will support. Once keep activating this particular point, certainly that will be helpful. Even for the acupressure, if we can teach to the patients, so better you keep applying the pressure to this particular point. Giving the pressure will not much harm. Deep pressure, galla dabadalo. Somebody says no, squeeze your neck region, definitely he'll go to heaven, not the hell, right? So we don't want to do that, but we don't want to go to heaven. Not now, it's not in our hands, right? By the way, just applying the pressure this bilaterally, that will be really useful to promote the triiodothyronine, thyroxine and thyroiodothyronine. So all are to be regulated by activating this particular point, right? So therefore we understand, be careful, because this particular area, what artery is existing? Carotid artery is existing. We should not damage that artery, that will causing the problem. By the way, it is really good point to treat for the hemiplegia, paralysis, and also the facial tongue related problem and speech related difficulties due to the hemiplegia. Even that conditions, we regulate the carotid artery. When the carotid artery is good, then the basilar artery is good, vertebral artery is good, circle of Willis is good, common cerebral artery is good, then the entire system of the head also good. Right? So we should be very careful. Now these are some of the important points on this region. Now another point to be known as a Shui Tu. Shui Tu means, Shui means is the water. So now you try to see. So before that I wanted to find out the stomach 11 point, Chi, Shi. chi shi point vertically below this point. Yes, vertically below this point you can find out there is a midway between the stomach 11 and then stomach 9. The point is situated, that is stomach 10 Shuaitu. Yes, so these are the 3 points. Also good to treat for the thyroid, located parathyroid, sidewise located, and the thymus gland also can be recommended. Thymus gland after the puberty, that will subsided. When the growth and development is not possible for the children, even for that condition also we can activate this gland, this particular hormone and gland, that will be good for the promotion and development of the child as well. The people who are suffering for the cerebral palsy or the autistic child, or the growth disorders, or the Down syndrome children, or the mentally retarded children, we just activate the thymus gland as well.